Hi, my name is Lexi R OW. I'm 17 years old and a senior at Frisco High School. This is my first year in ISM. Outside of ISM, I am the captain and second baseman for the varsity softball team. I intern at a small animal clinic called Phillips Creek Veterinary Hospital, and I rodeo. So these are just a few pictures of me. That's my family at our beach trip this past summer, and then me and two of my horses, and then my chocolate lab Zoe and my white lab Deuce. In the fall, I will be attending Oklahoma State University, where I will be majoring in animal science, specifically pre-veterinary medicine, and then minoring in equine science, so I have room to specialize. I plan to apply for an early admission program that Oklahoma State's veterinary school offers. Basically, I apply early and I actually get to interview, whereas if I were to go through my undergraduate and then apply for vet school, I wouldn't get the interview process. So it allows me to have that face-to-face interaction with someone and be able to show them who I really am and them not read about me on paper. The only requirement for that is I have to maintain a 3.5 GPA all the way throughout undergrad. If I happen to drop below that for whatever reason, I won't get penalized for it. The information isn't sent to the vet school until I finish my undergrad. And then I will also be a member of the OSU rodeo team. My quote for this year is, "Courage is being scared to death, but saddling up anyways." It's kind of something that my grandpa has always told me. We have a big sign in our barn that says that. And it's just something that I've always kind of lived by. I used to be super shy and in my shell, and I didn't like to do anything that required me to branch out, but ISM definitely required me to have courage and just go out and do it. So I talk about this horse a lot, but this is the horse that kind of inspired my entire journey. His name is Barbaro, and he was the 2006 Kentucky Derby winner. In the Preakness Stakes, he was pulled up by his jockey Edgar Prado, and he fractured his cannon and pastern bone. His sesamoid and his ankle was dislocated at the fetlock. So the first picture is him as a baby, which is kind of cute, and then that's him winning the Kentucky Derby. And then the far right picture, that is actually his x-ray after surgery. He had 23 screws put into a 16-hole plate, and the surgery lasted 7 hours. Unfortunately, in 2007, he died. As one would imagine, a horse can't really survive on 3 legs, and it's kind of devastating seeing them stalled and in a harness all the time, so it was probably for the better. My interviews, the first person I interviewed was Dr. Cole Skiba. He started at Weems & Stevens in 1999, and then in 2002 he became a partner. He is, Weems & Stevens is the only vet that he has worked at after finishing vet school, which is kind of unique because a lot of the veterinarians that work there, this was like their first job, and a lot of times you hear about people, they go like intern and then they get a job and then they're like, okay, I'm ready to move and like actually start. And so I just thought it was interesting that he's been there for so long and he still loves it. He used to rodeo as well, but he tore his ACL and hasn't since, and he's married and has 3 sons. My second interview was with Dr. Julianne Hunter. She is one of 2 veterinarians at Lazy Paw Vet, and it's actually off of Stonebrook, right across from the school. The other vet is her husband, which I thought she was kind of crazy for working with her husband. I'd probably kill my husband if I worked with him, but good for her. She made the transition from being an equine vet to a small animal vet in order to make time for her family. And for that for me really emphasized the fact that it is a very time-consuming job, and you have to make sacrifices either for yourself or for your family, and so that really brought some things into perspective for me. One really awesome thing is she does plan to go back to being an equine vet once her kids are old enough, so props to her for chasing after her dreams anyways. My third interview was with Dr. Lisa Schultz. She is the only female veterinarian at Weems & Stevens, and when I first heard this, I thought she was kind of crazy because who would want to work with 4 gross guys? But she holds her own, and I've come to realize that over the past few weeks. She is a graduate from Purdue University, and she specializes in the hoof and leg. She is the one who really brought it into mind for me that I can specialize and I can do all these things like a normal human doctor would do. So that was really interesting to me. And she also changed my mind because originally I wanted to be an on-site veterinarian at a U.S. racetrack, and I thought that that was my dream job, and there was nothing in the world that I wanted to do besides doing that. And she kind of talked about it for a while, and she basically told me the truth about the job, and that was that how many times are you going to have a horse trainer who's been in the industry for so many years come up to you and say, I don't know what's wrong with my horse? And like with Barbaro, for instance, they took him to Pennsylvania's New Bolton Center to have his surgery. He didn't have his surgery at the track. So that track veterinarian looked at him and said, yeah, he needs to go get x-rays. But what did they get to do after that? So that's just kind of what changed my mind. She also teaches the college class at NCTC on Wednesday nights. I thought this was really unique because, you know, you think of a vet and you're like, oh, they're a doctor for horses, that's all they really do. But she really brought it to sight for me that, you know, you're not restricted to one part of the job field. You can go out and you can teach, or you can do seminars for other people, or there's so many other things that you can do besides just working with horses. And she said that she enjoys that because it really gives her a break from, you know, actually being a vet. My fourth interview is with Dr. Kevin Claunch. He is one of 2 equine surgeons at Weems and Stevens Equine Hospital and a graduate from the University of Texas A&M. When I met Dr. Claunch, I thought he was crazy. For one, I couldn't see half of his face because he was geared up for surgery, and 2, he was asking me questions while he was removing a horse's eye. And I just thought that was absurd. Like, dude, you're removing a horse's eye, why are you talking to me? He is also married and has a son and a daughter on the way. My 5th interview was with Dr. Tyler Holtmeyer from Weems and Stevens Equine Hospital, and he's also my mentor, and this is us at the research showcase. Dr. Holtmeyer graduated from the University of Missouri in 2012. He also interned at Texas Equine Hospital with Dr. Cliff Honus after graduating. This is kind of cool because Texas Equine Hospital is in College Station, which is right next to where I'm from, so we kind of came from the same place. He started at Weems and Stevens in 2013. When I told people that, they were kind of shocked that I decided to work with a vet who has only been in the field for a year and a half. But when you really think about it, I mean, like, he's been through 4 years of school and then 4 years of vet school. Like, he's been doing this long enough to be able to teach me. And it also kind of helped me in a sense that, you know, he's basically fresh out of vet school and he's sitting here teaching me how to do all these things. And at first I was kind of worried, like, when I graduate, what am I going to know and what am I not going to know? And just seeing how much he knows has really given me hope, I guess. He is newly engaged and he loves to hunt and fish. He talks about it all the time. So a little bit about Weems and Stevens, which is where my mentor works. There's 5 veterinarians. There's Dr. Stevens, and then Dr. Skiba, Dr. Schultz, Dr. Holtmeyer, and Dr. Claunch, and that's the order that they were hired in. They also have interns from places outside of the U.S. So they have students come from Brazil and Argentina and Colombia, and basically what they're doing is learning as much as they can and purchasing all this equipment that they can take back to their home country and say, this is what I know, this is what I can use, and this is what I brought to you. And it really puts them on a higher scale where they're from because equine medicine there isn't as advanced as it is here. So that's awesome for them. It's a family atmosphere. There's always people joking around and everybody is just really close, and it's like, hey, you want to go to dinner? Like, they're always doing things together, and it's like they're one big happy family. And there's always learning experiences and always something new to do or to see. Every time I turn the corner, someone's like, Lexi, come look at this, or Lexi, let me talk to you about this. So even when Dr. Holtmeyer is filing paperwork or on the phone with somebody, I'm not just standing there like, what do I do? There's always something that I could be doing. So for my research, my career outlook basically just helped me get baseline facts about being an equine vet, and it helped me to set boundaries for myself and for my expectations. I knew what I wanted an equine veterinarian to be, but I didn't know what it actually was, to be honest. Like I had a general understanding, but I didn't know all the details. My first assessment was understanding the horse's engine. The engine is made up of the cardiovascular system and the respiratory system. I was really able to gain a clear comprehension over these 2 body systems. A lot of times people see horses as machines with like limits that are beyond belief, but honestly both systems have limitations just like a human does, and when we push horses too far, these 2 systems fail them, and that's kind of what I realized. I was also able to compare a racehorse to my horse, and it really puts things into perspective that not all horses are the same, just like not all humans are the same, and you can't treat every horse case like you can a human case. The next one or the next 3, I guess. I did these prior to knowing that I didn't want to be an on-site vet anymore. So these all had to do with racing and fatalities and stuff like that. The first one was over synthetic racing. The first thing that I really realized about this is that no matter what the track surface is, there's always going to be a horse that's going to be affected in a negative way, and there's always going to be a horse that's affected in a positive way. I mean, I can tell you that I run faster on grass than I do on dirt, but that's probably not necessarily true. And I could trip and fall in the grass and run fine in the dirt. And I mean, there's always different things that could be happening on any surface. And at first, I was really biased when I was reading these because I was like mad that, why would someone not want to do synthetic when it's better on this amount of horses and saving this many horses' lives. But now that I've taken a step back and looked at the big picture, I've realized that, hey, there's negatives and positives to everything, and I can't sit here and be on my soapbox about how I think dirt is a horrible thing when synthetic has its downfalls as well. The next one was racetrack fatalities. This is actually one that, well, I guess it wasn't recent, but this is a horse named 8 Bells, and she ran in the Kentucky Derby with Big Brown. I don't know how many of you guys know horse racing, but basically everyone was shocked because girl horses don't really run with boy horses, and when there's a successful girl horse, people are like, oh my god. So she finished second in the Kentucky Derby, and when she crossed the finish line, she broke both of her ankles and she was euthanized on the track. Well, there was a lot of, I guess, issues with this because there's 2 different types of people that go to horse races. There's the people that handicap and they gamble and they are at the track every weekend. And then there's the families who come and they're like, oh look, there's a racetrack in Arlington. Let's take our kids to go see these horses run because they'll think it's so cool because Megan loves horses and she'll be so excited to see all of them. Well, when a horse falls and they put up the big screen and the kids are freaking out because they're like, what are they doing to that horse, Mom? And then the parents are mortified. Well, it gives racing a bad rep, I guess. But you have to take into consideration how hard it's going to be to get that horse that can't walk on a trailer and then trailer it off, and then you have all these people up your butt like, what are you doing to that horse? And it's just, you have to think about it from their perspective. They're just trying to do what's best for the animal. So that's kind of what I had to take a step back and learn about. And then the last one was track changes in California. As angry as I was, it was nice to know that people are trying to change, and not everybody is gonna do exactly what you want, right when you want them to. So it was just nice for me knowing that people are trying and that people are doing their best, I guess, and that's all you can really ask for. So the industry is changing, but it's gonna take time. It's not gonna happen overnight. So my last research assessment was over advancements in equine medicine. This was actually an article written over the 2009 AAEP convention, which is the American Association of Equine Practitioners. They have a convention every year, and all the vets are invited, and they talk about what they've learned that year. So 3 things that really stood out to me from this particular article was that compounded drugs and medications are used in every sport to mask horses' pain, and that's where most of the problems occur. Like with horse racing, it's the most common because that's where most people see horses get hurt. But it happens in rodeo, it happens in show jumping, it happens every day. So that really brought things into a new mindset for me, I guess. The other thing I learned was that deafness in paint horses is kind of a prominent issue. I was kind of surprised when I read this because I have 2 paints and they act normal, but it's in homogeneous paints with blue eyes. The majority of them are born deaf, so that was kind of nice to learn, I guess. And then the last thing was the amount of unwanted horses in the U.S. has brought back the idea of having slaughterhouses being reopened. I was mortified when I first heard about this because I was like, why would you want to kill horses? But when you look at the chart with all the reasons as to why people no longer want the horses, it's actually more devastating than the fact that they want to open up slaughterhouses. The highest is that they can no longer afford the horse. But then there's reasons like the horse was unmanageable, the horse was injured, the horse was too old. And it's just, you think about it and you're like, you go into this financial situation knowing that a horse costs a lot of money and a horse is probably going to get sick from time to time just like a human would, and you're just going to throw it away when it gets hurt because you don't want to deal with it. So that kind of like was hard on me, I guess. So the best way for me to talk about what I've learned and what I've been through is to just kind of take you step by step through each of my mentor visits. It won't be long, I promise, but on January 8th, that was my first time like in the field, I guess. So there were a couple things that I did, but this is just one of them. There was a horse who came in for a pre-purchase exam. So pre-purchase exams basically are what the word is. Before a horse is bought, a lot of people like to get a vet check done to make sure that there's nothing wrong with the horse at all. So x-rays are usually taken. The horse is usually sedated for this because they have to stand on wooden blocks. So x-rays are taken of every angle of the leg. The horse is listened to. They ask general information from the previous owners. And it's just kind of helping people to realize that, hey, you know, you're not spending a bunch of money on something that's going to die tomorrow. So it's just reassurance for people. On the 14th, the picture on the left, that is of a colic exam. When a horse comes in for colic, which I'll get into that more a little bit later, but when a horse comes in for colic, there's a full exam that's done. That picture is of a horse that has a tube up its nose. Horses can't throw up. I don't know if you guys knew that or not, but they can't. So if it's not coming out the back end, it can't come out the front end, so it's just kind of stuck. So what we do is we put a tube down the horse's nose, and basically we pump water into their nose and then drain it out. And it gets all of that stuff out of their stomach, and then we'll pump mineral oil into their stomach and leave it in there. And as soon as the mineral oil passes, you know that they're cleared. So it's basically just a way of saying, okay, I'm all better now, without them having to tell us. The second picture that's on the top, that's basically just a picture of a foal whose legs grew too fast. So it's like the awkward teenager who is too big for its body. That's basically what happened. They just get swelling of the legs. So she has swelling in her back knees. The picture below that is a picture of a dummy foal, and a lot of people get offended when you tell them that their foal is a dummy foal. But basically what a dummy foal is, it's a foal that can function and breathe and do normal things, but it doesn't recognize its mom, it doesn't know how to nurse, it doesn't know how to walk, and it just kind of lays there like a dummy, like it's lifeless almost. The picture in the top is of an ultrasound. We had a barrel horse come in with pneumonia. It's really devastating to see, but it's really cool to see in an ultrasound, so that was one of the things that I got to see. And then the bottom picture is a horse with a tracheotomy. Basically, the owner called and said, my horse is having trouble breathing, and when we got there, the windpipe was about that big around, and she sounded like a mummy. And so what we did is made an incision in her throat, and then that metal thing is instilled in there, and it just gives her a new airway. You can actually stick your finger in the trachea of the horse, and it's kind of gross. But on January 19th, one thing that I got to see was a horse with an abscess. An abscess is basically, it's inevitable. Your horse is going to get an abscess at some time in its life. But when the hoof gets cracks in the bottom of it and then dirt and everything compiles in there, it'll form this like pus pocket, I guess. And sometimes the hoof layers will grow over it, so you just have to drain it out. So that's just a picture of it, what it looks like when it starts to drain. The middle picture is of a horse with face paralysis. He actually got his head stuck up underneath a fence, and there's 2 pressure points on either side of the face, and when too much pressure is put on one side, the whole side of the face will look like the horse had a stroke, basically, so the lip will drop, and it will heal on its own, but it takes some time, and it's kind of sad because they don't look normal, obviously, but he'll be okay. And then the last picture, that is what it looks like when you're taking blood from a horse. We actually have these needles that have caps on the end of them, and it's a double-sided needle basically. And so instead of having to poke the horse multiple times to fill up multiple tubes, you just keep that one needle in and then poke the tube at the bottom of the needle, and it just fills. And January 19th was the first time that Dr. Holtmeyer let me draw blood from a horse, so that was kind of exciting. On the 28th, he told me we were going out on a farm call, and so I met him at Stony Glen Stables. And this was actually my best friend's horse, Tigger, and then that's Pete. He's a vet tech. He's one of the people who came from a different country. What we did was we floated Tigger's teeth. So the top picture is the before. I don't know if you guys can tell, but on the top teeth we'll cut the side of the mouth where the cheek is, and then the bottom teeth will cut the tongue, and it'll form these ulcers. And so they recommend that you get your horse's teeth floated every year. Basically, it just makes them more comfortable while they're eating. A horse's teeth will grow according to their eating patterns, and so it'll get sharper on the outside if they're chewing on the inside, and vice versa. So the after picture, you can see that all the teeth are rounded off, and it's just a lot more comfortable. Another thing to take note of is the top tooth in the very, very front is really, really sharp. When horses have bits in their mouth, it pushes back their mouth and it'll start to rub on those front teeth and cut them. A lot of time if your horse is tossing its head or acting abnormal while you're riding it, the number one thing to do would be to check its front teeth, because if it's having discomfort while the bit is in the mouth, then obviously it's not going to act normal. I mean, if my mouth was getting cut, I would not be cooperating either. So this is one of the coolest things about it, is you get to see like before and after. So that's Tigger before, and then that's Tigger after. So on January 28th, this is the same day, I also got to go to Medieval Times. I knew that Dr. Holtmeyer was a vet, but I didn't know he was the vet for Medieval Times, and it never really occurred to me that Medieval Times needs a vet. I just thought that the horses took care of themselves, I guess. But anyway, so the horse on the left, I guess I could tell you names, but I don't know if I can because of like security purposes, but if you want to Google them, this is what they look like. But the horse on the left, he had a quarter crack, which basically is just a crack in the hoof. It's really uncomfortable for them. It'll start to pinch where the hoof meets the skin, and they're an easy fix. You just have to dry them out, but it's really hard whenever you have a horse that performs every night that has a quarter crack, because he can't perform with it. And then the horse on the right, he popped his splint bone, which caused him to go lame. A popped splint bone, basically you can see it when you look at a horse's leg, but it will kind of bulge out on the side. They will heal on their own. It's not like the horse needs a cast or anything, but this horse in particular is the only horse from Medieval Times of his type, so they had to rearrange the entire show around him, like completely change the show because he couldn't perform. So that was kind of sad. Oh, I can't click. Okay. And then February 6th, this was my most recent mentor visit. I haven't even talked to Coach Goff about this one yet, but we went back to Medieval Times to float all of the horses' teeth. They have 22 horses, so Dr. Holtmeyer was out there for 2 days. Since I could only go during the ISM period on that particular day, I only got to see 4 horses. When I got there, Dr. Holtmeyer was finishing up one of the horses, and we were just kind of talking, I guess, and then he took his gloves off when he was done, and he was like, "Oh, Lexi, you got the next one right, because I'm tired." And I just kind of looked at him like, "Are you kidding? I'm not going to float this horse's teeth." And he went out to the truck and grabbed the box of small gloves, and he said, "No, you thought I was kidding." So the next 3 horses, I floated their teeth. So that was pretty awesome. I got to play vet dentist for the day. In the picture on the right, I didn't get the pictures from Dr. Holtmeyer of myself yet, but the picture on the right, that's basically what the flotation device looks like. So the horse is sedated, and then they put this harness over them, and it cups around the front teeth on the top and the bottom, and then you just kind of tie it up. It doesn't hurt them, but the drill, it's about 1 foot long on the end, and it has this little circle with a disc, and it spins in a circle, and you can put it on your hand, and it just vibrates really fast and spins. And what it does is it just files down all of those teeth. It doesn't take that long to do, and it doesn't hurt them anyway. I mean, I haven't seen any of the horses bleed yet, so that's a good sign. But you just go through over all of the teeth and file them down. The only thing that I was kind of worried about is he didn't tell me all the things that could happen and go wrong until I sat down in the chair and had the drill in my hand. So obviously, if the tooth gets too hot, the tooth will die, so you can't stay on a particular tooth for a certain amount of time, and then you can only take 3 to 5 millimeters off the tooth. So there was a horse that had a wave mouth, meaning that his bottom teeth started low and then they went higher and then they went down again, and then his top teeth did the opposite. So when he closed his mouth, his teeth fit together, but one tooth was super duper long and the rest of them were short. Well, you can't file all of that down because you take too much of the tooth and it'll kill it. So if a horse has a wave mouth, they have a wave mouth for the rest of their life, because a horse doesn't get horse braces. So, and then the 3 horses that I happened to do the teeth on, they were the quarter horses of the show. So Medieval Times has Andalusians and then they have quarter horses. The Andalusians do all the fancy stuff like what you saw on the slide before this. And then the quarter horses are the ones that they run and fall off of dramatically when they get stabbed with fake swords. So that's that. And then the last thing really that I've gotten to experience is I've gotten to work with 2 of my really good friends' horses. That's Tigger and Taylor on the left again, and he's the horse that I got to float teeth on. And then the picture on the right is Hannah Kennedy and her horse Presley. Presley got an eye infection and they prescribed the wrong medicine to her on accident. And her eye ruptured, and now Presley has 1 eye, and she had her surgery 2 days ago, I think. So if I knew then what I knew now about being an equine vet, I wouldn't change my mind for the world. Actually, I probably would have been a lot more willing to jump into this than I was before. So my ISM journey has taught me a lot of things, but the first thing that it's taught me is when you see a chance, take it, and don't have any doubts in your mind, because I was really doubting this journey at first, and then now I've kind of come to the realization that like there was no reason for me to be scared at all. So this has sparked 3 interests for me. The first one is foaling. I think baby horses are adorable, and that is actually a picture I found of my horse when he was a baby. So he was cuter than he is now. But the middle picture is orthopedics. So just like there's orthopedic surgeons for people, there are orthopedic surgeons for horses. And then dentistry, because I actually got to float teeth, so that was kind of cool.
Pause. Stop and restart.